Causes, complications, and treatments. Hip dislocation. According to the best orthopedic surgeon in Kolkata, people who prolong hip damage will have grave hip pain, trouble moving and incapability to stand weight on the fringe. The leg will be in an irregular position as an outcome of the dislocation, most often with the leg rotate and shortened. Hip dislocations can also happen as a snag of hip replacement surgery. As an artificial hip replacement is unlike a usual hip joint, dislocation point joint replacement is probable danger of surgery. What happens when the hip gets dislocated? When a hip dislocation does happen, there has to be an injury to the arrangements that bear the ball in the socket. General damages that happen when a hip dislocation occurs comprise fractures of the bone around the hip, tears in the ligaments and labrum of the hip, and cartilage injury of the joint. Besides, damage to blood vessels that nurture the bone can result in a condition known as avascular necrosis. Treatment that can be done. The most essential treatment of a dislocated hip is to correctly place the ball back in the socket, known as a joint reduction. To relocate the hip joint, the patient will need normal anesthesia. Not like a shoulder dislocation that most patients, particularly those who have had recurring shoulder dislocations, can relocate on their own. A hip dislocation generally needs important force to relocation. Hip arthroscopy is turning more generally used as a tool to make sure the joint is as healthy as possible post this kind of injury. Besides, the progress of premature arthritis of the hip is extremely general post the kind of ordeal to the hip joint. People who prolong these damages are at major risk for growing difficulties such as arthritis and osteonecrosis of the hip joint. In the end, hip replacement